Hello, folks. Welcome to another episode of Inside the Marble Palace, Post Media's podcast. With me today is Arthur White-Crummy from the Leader Post, Adam Hunter from CBC, our provincial affairs reporter for CBC. Hi, Adam. Hi, Arthur. Hey, I got to show you the most prized possession of my generation since the Bobby Orr power player card brought out by Esso 40 years ago. Look at this, folks.
Yeah.
Hey, I'm vaccinated because I'm old. And
Prized possession.
It is. The lineups were incredible this morning, starting at 7 in the morning. But they are moving people through very quickly. And we're going to talk about that interestingly today. I find it interesting because I think for the first time, I'll start with you, Arthur, the Premier really does seem to be caught between those that are really clamoring for shutdowns or an end to the shutdowns, and those that are basically saying we need to shut down more because of what's going on inside Regina. We now know that, contrary to the rest of the province, we won't be able to have church services the same as elsewhere because that limitation has been retracted by the Premier. He didn't move very far next week in terms of the restrictions he had. But I want to get a sense from you, Arthur, because you were actually out there on the lines talking to people this week. Is there starting to be a balance or more of a balance in Scott Moes' mind between people who are legitimately scared about what's happening in Regina, people that might normally be supportive of Scott Moe and his initiatives and be quite supportive of how he's handled it so far, versus those who have been really encouraging Scott Moe and the provincial government to open up? Because for the first time, I'm really kind of sensing that balance in Regina, at least in Regina, in a way I haven't seen it before. And that's got to put any politician in a horribly precarious position.
Well, I mean, I think he's been wedged between those two pressure groups, if we want to call them that, for several months, if not much longer now. It just is really coming to a head right now because of the unfortunate timing, where we are just weeks away from having virtually all vulnerable people having their first shot of vaccine, and the variants are surging up on the scene at the exact same time. So clearly it's derailing the plans that I would imagine the Sask Party and Scott Moe have had in mind for some time, that as soon as they're able to get that level of protection, that they can begin opening up more of the economy. But it's and pulling back on some of these restrictions that have been biting into our social lives for about a year now, and certainly at a high rate since December. So I think that pressure has always been there, but it's just really culminating where the stakes of these kinds of decisions are just a lot more visible, because he's been able to avoid the kind of shutdowns that we've seen in Ontario and Quebec and other provinces for the entirety of the fall and winter. It would really be an unfortunate political concession from his perspective, I believe, if he were forced to make that at the very end, when we're just pretty much seeing the light at the end of the tunnel. To have to impose even a regionally specific lockdown, I think in some ways would be an admission of defeat that he really doesn't want to have to make.
Yeah, and not the time where he really wants to admit defeat on anything. What's your take, Adam? Because I'm interested. Your story today made the top of the national CBC newscast today. And I'm trying to remember last time what would be considered to be a purely local story having that much national prominence. But that's how big a deal right now the Regina variant outbreak is. And I can't imagine that within the government ranks, they aren't feeling pressure. As Arthur said, he for the first time, he probably is seeing a little bit of both, even though he was seeing a lot of it all through. But is this a game changer in terms of how the provincial government now has to start addressing some of these issues in your mind? And did you sense some of that in yesterday's news conference, which you attended?
I think, you never want to make headlines for the wrong reasons. And that's what happened this morning, as you mentioned. So thanks for listening also, Murray. Appreciate it. But we have we have a sort of a dubious target right now in Regina specifically, where the variants aren't spread across the province, and we're not a large center. Sometimes the big numbers in places like Toronto or Calgary, Vancouver, people may dismiss them because they're big centers. But when you see 90% of confirmed variant cases in one place, and the number is going up in Regina, active cases double what they are in Saskatoon, which has a bigger population and had led Regina previously for quite some time with active cases, then it gives everyone pause in the city. And I asked Premier Moe yesterday about the decision to expand bubbles and allow for 10 people to gather last Tuesday, when on Friday they put a recommendation that maybe you shouldn't do that. And there are a few people that are saying now, like, we need either, something solid saying, do this, this is what you should be doing, or the other way, that the sort of the in-between is really hard for people to follow that kind of guidance. And Regina is one of the only places that has allowed people to gather indoors, where some of these other centers across the country are still not allowing that because of just COVID, not necessarily variant concerns. So I think, to Arthur's point, there's always been this look to the future, even going back to last April, when the Premier was telling people, where we flatten the curve, we're going to get through this, and into the fall, into the winter, over Christmas, let's stay apart so we can get these cases down. And yesterday, there wasn't as much of that. I didn't sense the urgency from the Premier and Dr. Shahab over the variants, even though they're spreading faster. And Dr. Shahab said even he was surprised by how fast they spread, judging by what they're doing through contact tracing. So it's going to be difficult because the government has never made a plan to treat the province differently since maybe last summer. They've always allowed the rules to apply everywhere. And to go back on the promise last week to allow people to see family and friends, to expand bubbles, just a week later, would say, maybe we miscalculated this. They would have to admit a mistake. But I think going forward, if we see the cases rise in Regina at a rate that is unsustainable for the hospitals, and that's always been the point for Dr. Shahab and the Premier, then I think you'll see a regional scale back, because there's a lot of opportunities now for people to go outside, but we do have Easter. We're speaking on St. Patrick's Day. We'll have Easter break when kids are out of school. So there's opportunity. If people are allowed to gather, they're going to feel comfortable doing it. And this is an invisible virus. People don't know the threat of it until it affects them or a loved one or someone at work, or they're having to isolate. And I think that's always been difficult for people to balance that unknown threat with what they really want to do. And they miss their family, they miss their friends. As Arthur said, they miss socializing. And so that yesterday, the message, I don't think was what many people in Regina were expecting. And certainly the message from the mayor was similar to what the Premier said. And the mayor said, their hands are tied. They're not going to implement anything that they don't have a backing from the provincial government. They can't close bars and restaurants down if the provincial government's going to say, well, we don't agree with this. They want support from the public.
That's an interesting point. I'm going to get Arthur to talk about the mayor's message in a moment versus the Premier's message, and if there was differences. But before I just leave you, Adam, for a second, can you expand a little bit on the demeanor of the Premier, because you were in the room. I was watching it from a distance, and sometimes you don't get quite the same sense. But I guess I was impressed with one thing, and that was kind of the coolness and calmness of the message of we have to be cautious yet optimistic. I'm not so sure the content really worked with that messaging, because you still had the contradictory thing. But if I think there is one thing that worked for Premier Scott Moe yesterday, is that he did kind of look like a guy in control and a guy that had a plan, even if some of the things that he did and said suggested that it's a plan that's inconsistent and might not work that easily. But tell us about his demeanor. After a year of this, you'd think some of this pressure would be getting to him on this particular issue.
I mean, it was quite different from last Tuesday, when it was the Great Day in Saskatchewan press conference,
yes.
Where we were talking about vaccines, and it was in stark contrast to that, I think. And I think the tone probably was because of the variant threat and what the numbers are saying in Regina. You can't really boast about how great things are going if the capital city is having this variant threat. But at the same time, you're in the line, Murray, for vaccines. People are seeing that coming, and that's always been, since December, the government's message. The vaccines are coming. We're getting more people vaccinated. And I think the struggle for people right now is that if you're not in Regina, you see the numbers in your area, and you're going, okay, well, this is way better than it was in November even. Why can't we get together? Why can't we go to church? Why can't we have Easter dinner together? And in Regina, it's quite different because we see the cases in schools where kids are having to isolate. You see that number of variants. And health officials, we all do these stories where health officials, health experts, epidemiologists say, more needs to be done. The variants are very scary. This is going to cause more young people to end up in hospital just based on how they're spread. Yet that wasn't matched with any of the measures that maybe had been calling for from the outside.
From them, and including that outside is now the city of Regina and the mayor's office.
Yes.
Arthur, what's the difference between what you think or what you're hearing from City Hall in Regina versus what you're hearing from the legislature? And having covered both, it might be easier for you to assess the politics within. But certainly, I thought that Sandra Masters was delivering a different message than Scott Moe, and maybe one with a little bit more urgency to it. Am I wrong there?
I mean, I wouldn't say that it was a directly a contradictory message, but certainly there was a different tone to it. She expressed a great deal of concern over what she had witnessed in the city, saying she's seeing large groups of people, even in the parks, gathering without any appreciable social distancing. She says she's in regular conversation with the province and is basically on standby for the possibility of further public health measures. I got the sense, listening to the press conference, that it's something that she's very receptive to, but as Adam said, something that she doesn't necessarily have the ability to enact on her own authority because of jurisdictional issues. So it didn't seem to me as though she was undermining the kind of provincial provincial message, but it was certainly a different sort of press conference than what we saw only half an hour later.
Yeah, and different in tone. And Adam, I can't believe that he kind of kicked sand over that line he drew in the sand during the election campaign of saying that we will not go back into lockdown. In yesterday's press conference, Premier Scott Moe explored the possibility that Regina might have to go into lockdown, as the mayor suggested was a realistic possibility if the numbers worsen. Fortunately, we're seeing today, at least for today, lesser numbers overall in the province. I think 87 cases and 27 in Regina. Am I right, guys?
Yeah, 87 overall, 27 in the city. No more reported no more confirmed variant cases.
Yeah, and understand, folks, for those who think that we're ghouls out there, there's nothing that we like more than seeing these numbers go down on a daily basis. It does our heart good because we know what we're going to be delivering. But in that regard, Adam, what do you think might be the case if the numbers go back to what we have saw the previous day or the day before that, and certainly with the large variant numbers setting in? Is there a willingness now on the part of Scott Moe to basically say, we need to do something beyond leaving Regina behind in terms of Easter Sunday church services and a few other things going on that might be able to go on elsewhere in the province that can't go on here? Would he, under tough circumstances now, because of public pressure, because of the things we've been talking about, be willing to lock down things a little bit more in the city? Or is there still a sense that might be the hardest thing that he would do for him to do, and something that he just couldn't do?
I think the sense I'm getting from the last few press conferences is that's the absolute last resort. If we're talking a lockdown, that would be a last resort. If we're talking about incremental measures, which is what the government's done throughout the pandemic, I think that's something you more look at. Schools will only be shut down by school divisions. That won't be something the government decides to do. Workplaces, you could have a work from home edict from the government for government employees. That's something that they could do. The city of Regina talked about that yesterday, that they have about 85% of their staff working from home. Those are sorts of things that would be, I think, maybe the first to drop. But the issue is going to come down to how high do the cases get, how high do hospitalizations get. So if we see hospitalizations in Regina specifically climb to the point where the SHA, and we've seen, in some of these physician town halls where some of their leaders are speaking out, and then we have more and more, I think, increasingly some of these experts in their fields, doctors, well-respected people in the province that are coming out and saying, okay, we have to stop this before it gets started, because we're ways away from people receiving immunity to the vaccine, to the virus from a vaccine. So even if we get everyone who's in that 15 over category vaccinated by the end of the month or by the end of May, you're still going to need a couple of weeks after that for immunity to kick in. And we still have all these people that are working, going to school, and being out in the public that are, younger than you, Murray, that are able to spread the virus, right?
I didn't see any today, by the way. There was no one younger than me.
So I think the louder the voices of certain experts get, the louder the voices of people in the healthcare field who are seeing the effects of the variant firsthand, I think that's when the pressure ramps up. But if I were to just, say, are we going to see something next week? They're saying they're going to go by this week to week. And that, to me, signals that there's going to be maybe a small targeted change if they see an outbreak in a certain area, then move to the next thing. And Dr. Shahab has said, we're not seeing outbreaks or cases go through restaurants. We're seeing in schools that cases come into schools. They don't spread through the schools. So as long as that continues, I don't think those things will get shut down. But unless you do an entire lockdown, you can't affect schools without affecting something else in the community, right? Because those kids are bringing potentially the virus in from family who are going to work and meeting out in the public. So I think that's the thing for people to watch for. If we see the hospitalizations rise, and the criticism rise, that's what will trigger a change.
I'm going to get you guys to help me answer something that I am asked all the time and I can never answer, because we do not get the answer from the provincial government. And thankfully, Alison Bamford, I believe, from Global, asked the question yesterday again, which is, what are the parameters? What has to happen? What numbers do we have to have before we move to that next step and have some kind of either circuit breaker, lockdown, however you want to describe it? I know that we're not getting that from the provincial government, and the Premier and Dr. Shahab did not answer that yesterday. But I guess I'll start with you, Adam, and we'll get, if you have any thoughts on this, please join in, Arthur. But is there a number in your mind from what you've seen and witnessed over the last year where it's almost a call to action by either the chief medical officer recommending changes in terms of how we're doing things, or basically the Premier saying, well, I guess I really do have to do something more severe than limit church services or something? Is there a number of 100 hospitalizations in the province, or 150 hospitalizations, or so many people in ICUs? Are you sensing that, either one of you? I'll start with you, Adam, if you have any thoughts.
I think this is something we've been asking. Arthur knows this for a long time, about a threshold for everything, and we haven't ever got one. I think the closest Dr. Shahab has said is, the hospitals being pushed to the limit. And, I think at one point he said 150 cases a day. We could kind of relax. He was more comfortable with 60 to 80 range in the province. But that has changed with the introduction of the vaccines, because the vaccines are seen as the way out of this. So I think that's a really difficult question for us to kind of grasp, because we're not getting that answer. Yeah. And every time we do ask about those cases, we get an answer, especially from the government side. Vaccines are the way out of this. We need to get more people vaccinated. So that would be my answer.
And Arthur, vaccines are the way out of this. Yes, it is. But it's not necessarily a helpful answer to the public, because the vaccine rollout, even at today's pace related to these clinics, and I think they've been very successful. They've been successful when you have people lined up literally for hours, waiting to do something that the government wants them to do. And the worst case scenario obviously would have been people not waiting and not lining up for vaccines and moving forward. But do you think there's even a number with a certain percentage of the population vaccinated in which the Premier might even start lifting restrictions? Or is there a number that you have in mind or have thought about that if we reach that, well, it looks like to me that the province is going to have to do something in the other direction?
Well, I'm not going to provide a specific number, obviously, but it seems to me as though it's not herd immunity. It's not achieving the 80% or so that we would need to totally cut out the spread of to cut out the spread of the virus. When Scott Moe was asked about the pacing of paring back some of his restrictions, he talked about the fact that within 3 weeks we're going to have 85 or 86% of the people within Regina that are in vulnerable age groups over 60 vaccinated. So it seems like they're paying very close attention to the vaccine coverage of people that are at risk of hospitalization and at risk of death at a disproportionate rate. And that's not really surprising, because throughout this pandemic, that seems to have been their goal, to protect the health system and to prevent very high rates of death. So if we have a large share of those vulnerable seniors like yourself vaccinated, Murray, then I think that we can expect to see an acceleration.
Senior-ish.
Senior-ish. Okay.
Yeah.
Well, I mean,
Senior
it's all in. It's all in the eye of the beholder. I'm pretty sure you can get breakfast discounts at a very large share of restaurants. So that
I was like Wilfred Brimley. I was able to get that at 23. So like, I mean, it's without making light of things, though, it is absolutely wonderful to see the volume of people participating today and the number of people getting out there. That's exactly what the government wants to happen. We saw a tremendous number. I saw a tremendous number of people that I know probably weren't from Regina, given the fact that the sign on the truck said, "Hey, I'm not from Regina. I'm from Belcarris or Watrous or wherever else there is from." But that's, I think, probably a good thing too. I don't know if it necessarily achieves what they want to achieve by bringing the Regina case numbers down, because obviously that's where the critical area is right now. Is that the next step? I guess we'll pretty much have to leave it there because we're running out of time. But is everything going to be in the next few days to weeks going to be about those Regina numbers, seeing if they spread elsewhere in the province and seeing whether they go down in the capital city? Is that the key in your mind right now in terms of what triggers the government to make its next move, Adam?
I think Regina is the focus. You mentioned off the top, Murray, that national news was interested in Regina. Yeah. The numbers are really stark when you compare it to the rest of the province. And I think the point you made there about the spread to the other parts of the province is key, because Regina isn't a fortified city. We have people come in and out for work, to see family. This past weekend, people were allowed to see family for the first time without being fined. So they definitely came in from out of town for sure. They came in to shop, they came in to eat. And we'll have to wait and see if that affects the numbers in those communities. Hopefully it doesn't. I know you made the point about wanting to cheer the virus down and cheer the numbers down. I know we're all in the same boat on that. And we have to just keep an eye on how Regina is going, and the messaging too, right? If people are giving clear guidance about what they can and can't do, what they should and shouldn't do, then maybe we do see numbers go down like they have in the past. And if that's not the case, then we'll be having this conversation in a couple of weeks about what's going to be done about Regina's variant spread. But hopefully we're talking about vaccinations and vaccination rates and numbers going down, and that's where we'd all like to be.
Yeah, I sincerely hope so. Well, thank you both, Adam Hunter, Arthur White-Crummey from the Leader Post, Adam Hunter from CBC, and we'll hopefully see you sometime soon on our next podcast. Take care, guys. Thanks again.
Thanks, Murray. Thanks, Arthur.
See you soon.